lots and lots of people in the UK and worldwide. So this is first of our 7 free talks. I hope you can attend as many as you can. If you're new to the Center for Investigative Journalism, the CIJ was established in 2003. It was established by American investigative journalist Gavin McFadden, and it was done because there was a need for investigative journalism training in newsrooms, and nobody was doing it then, so we came on board. And we've been doing it for years. Summer conference has been our main event, and now we do much more. We have a biannual symposium, we do online training, we do classroom training throughout the year, well, not now, obviously. And so we've increased our workload significantly. This talk is also webcast through our YouTube channel. So if you want to watch it there, or if you want to share it with friends, please do. My name is Marina Count. I've been organizing summer conferences for 12 years. I will be today's moderator. Before I introduce you to our speakers, I need to do some housekeeping rules. We will be answering your questions at the end of the talks, of all the 3 talks. Please post your questions in the Q&A section and not in comments, because we will not be seeing question and comments. However, my colleague Tom, whom you can't see, will be monitoring all activities. So please be nice to each other, nice to the speakers, don't say nasty things, we will kick you out. And of course, please feel free to share what you're watching and what you're thinking on social media using CIJSummer hashtag. So now to the main event. We're here to talk about data and COVID-19. We have 3 excellent speakers today. I'm not even going to say that they're award-winning, they're all award-winning. We always get the best people. So Helena Bengtsson, there she is. She's a Swedish journalist, editor for data at Sveriges Television, Swedish national television broadcaster. And she used to be, before that, editor of data projects at The Guardian. Then we have Burn-Murdoch, a senior data visualization journalism at the Financial Times. You may have been following him on Twitter. He's been doing a lot of exciting tweets that lots of people have been following. And then we have Pamela Duncan, who is an award-winning journalist working for The Guardian's data projects team. And Pamela will start it all off with talking about UK COVID-19 data and death rates, and how difficult it was to find a way of actually getting to the right numbers and analyzing it. So over to you, Pamela.
Hello, everybody. So thank you very much for having me, Marina and Tom and CIJ. This is my first time doing this kind of online conference, so I'm a little bit out of my depth. So I hope you'll all forgive me if I stumble. But yeah, so I work for the Guardian data projects team, as Marina pointed out, and I was actually just back from a conference in New Orleans when coronavirus really hit home in the UK. And I was already in self-quarantine when we realized just the enormity of what was happening. I think that immediately what became clear when coronavirus hit was that the data projects team was going to have a very central role in the newsroom when it came to dealing with this. The first couple of days were, I mean, kind of crazy, and of course we didn't know what was going on. I wasn't allowed into the office already. My colleagues were still there. But on the 17th of March, I wrote my first coronavirus story. The story was called The UK's Coronavirus in Numbers. I'm just going to share my screen here and show you guys what the story was. So it was a pretty basic story, if you can see everybody. So we wrote a story basically crunching the data behind the government's approach to tackling the crisis. We had some graphics in, and we were trying to grasp at that point just who would be affected. And we realized that it was going to be an awful lot of people who are going to be affected for an awful lot of time, both personally and economically. but I don't think anybody could have known at that point just how big this story would become. So yesterday when I was preparing for this, I looked up my stories since the 17th of March, and I realized that I've written or contributed to 53 stories and live blogs, 52 of which were coronavirus related. So I mean, my working life has been completely overtaken by this event. And out of the 52 stories that were coronavirus related, just 2 of those were not around deaths. So I suppose I'm here today to talk about, firstly, the enormity of something like this when it occurs, ways to be prepared for something as an event that's this seismic, and also what I learned in the process of covering one thing and one thing alone for 3 months straight. Just to say, I mean, that's not usually our remit. Usually we jump between topics and we're, spending an awful lot of different stories at any one time, and we have different responsibilities. But my kind of beat within data is also, one of my beats is health, and therefore I was pulled into this kind of wholesale from the beginning. So the Guardian data team decided very early on that we, given the importance of this topic, and we already had an idea that there was not a really robust test and trace system in place in the UK. So we decided that measuring deaths caused by coronavirus was the most robust way of counting the cost to society. But we did not know at that point, and it was a big learning curve for us, was this would mean like grappling with 9 different government bodies and statistical agencies which release all this data on different days to different standards, including different things. So it was the 3 weeks after I published my first story on the topic, the data team all contributed to an article entitled "Coronavirus UK Death Toll: Why what we think we know is wrong." And in that story, we kind of explored some of the pitfalls of some of the pitfalls in some of the government data. And basically, there's a conversation I keep having again and again with colleagues and, in my personal life, which is, why do we have 2 different sets of figures coming out for government? So one day you hear it's 40,000, the next thing you hear it's 55,000, the next thing you hear it's 65,000 excess deaths. And weirdly, all of these figures are correct at the time of writing, in that the government collects and publishes information on the number of deaths that occur in hospitals and care homes that have had a positive test. So they will say that this is perfectly transparent and normal, that they should release this data because they can do so in a very timely way. But about 12 days later, the ONS brings out its figures, and they include all deaths that have COVID on a death certificate, and as such are therefore much more robust, much more comprehensive figures than those published by government. But what we also found at the very beginning was that there were serious time lags in the number of in the way the different statistical agencies were even themselves presenting the deaths. So for example, NHS England would give you would tell you how many deaths there were one day, but it would turn out a week and a half later that there had actually been many more deaths, and that's the same day. And so it was a big learning curve for us, just trying to make sense of all this information. Normally as a journalist, you act as a sort of a translator to the public, right? You're the one that's in the newsroom explaining, you're the one taking in all this information, making it more accessible to the public, and explaining it in a way that people can understand. But in actual fact, in this, we were also explaining it to our colleagues, because everybody was grappling with this. So one thing I learned early on was that actually we weren't the only ones grappling with this. Our sources were also finding it very the NHS England had never experienced anything like this. National Records of Scotland had never experienced any of this. So one of the things that I thought I'd share with you is the idea that, the enormity of the challenge ahead, and everybody kind of grasping the nettle at the same time, just trying to figure out the best way to do all of this, meant we needed to be organized. So one of the first things I did was to put together a list of contacts, so appropriate sources in every one of the statistical bodies that we needed to be in contact with. In the UK, obviously, you have different statistical bodies for each of the, for England and Wales, that a separate one for Scotland and a separate one again for Northern Ireland. So we made a list of contacts. We put together a list of epidemiologists. We put together a list of statisticians. And these are the people who I went back to again and again over the course of the pandemic to ask for their advice and to really kind of make sure that I fully understood the data that I was putting out at any point, because epidemiology was not something I knew very much about before this. As I mentioned, the challenges to the public health bodies and statistical agencies was immense. There are times, like as a data journalist, and you feel like you're nearly fighting to get to get data from people. But in this case, it didn't feel like that. It felt like they were also trying to reorientate themselves and how they worked. What I found was actually, in most cases, both sides became very understanding and respectful to one another in that process. And there was also a level of frustration at times within those statistical bodies as to how the whole thing was being handled at a higher level and how the data was being collected. And as a journalist, that actually played to our advantage. So it meant I was pushing an open door at least some of the time. So the takeaways from that part when it comes to contacts in a crisis, I would say, is immediately draw up a list of experts and start hitting the phones, talk to these people. Wherever possible, talk to the statistician directly. They will understand it far better than the press person in between. Certainly keep the press person involved, but keep everybody on the same page. And I think that will always stand to you in your reporting. Also, respect the pressure that your contacts are under. It will stand to you because you will understand those organizations so much better. So you'll make your stories richer as a result. And also, again, you're pushing an open door when it comes to getting data in the future. The other point I would like to make is around dealing with the newsroom. So on the 21st of May, around then, there were headlines in 2 national papers claiming that no deaths had occurred in major London hospitals in the last 48 hours, or that a significant minority of trusts countrywide had reported no deaths in the past 2 days. And immediately when these stories came out, people from the news desk came to us and they said, well, why, oh, this is great. Why aren't we following this story? And as data journalists, you have to say, well, it's not true. There have been deaths in the past 24, 48 hours. It's simply that they don't show up in the records because we already know from our contacts that sometimes it takes time, especially at the weekend, from a death to be reported from trust level up to national level. And so we had, so there were times along the way where we had to say, no, we cannot provide this because we as data journalists could not stand over that. So while COVID-19 has definitely helped cement the importance of data journalism in the newsroom, the pandemic also highlighted some of those kind of day-to-day pressures that we as data journalists kind of experience. So like my takeaways from that are like that sometimes, you kind of, with the news desk, you do have to ensure that you're, like what I would say is just simplify your top line as best you can, but always bake in your methodology, because you as a data journalist are held to a very, very high standard. And also always fight back against bad data. There's a very old saying in journalism, as in programming, rubbish in, rubbish out. So make sure that you can stand over what you're writing, because it will come back to bite you if you don't know your data thoroughly enough. Also, I found in this experience that it was great to know your news lines in advance. So although it wasn't much fun at the time, I was counting was running counts of excess deaths every week. I was keeping a daily count of coronavirus tests or updating my diary to make sure I was freed up in a day when an NHS England release was coming out. And that meant I was able to keep abreast of the milestones. So for example, when adding up all the different statistical agencies' deaths, I knew the day that it was likely to, that 20,000 excess deaths occurring in people's home would have occurred, or 50,000 deaths occurred across the UK on the 2nd of June. Or I was able to prepare the desk for the fact that unprecedented number of patients missed out on vital cancer screenings and treatments, diagnostic tests and outpatient appointments. And that all stood to me, not just in terms of, getting a decent placement in the paper and getting my story out there, but it also meant that I was more organized for when these things fell. My last point, I suppose, is around calling out the data gaps. As I've said before, there were plenty of missteps by government in all of this, and the stories that we found had the most impact and had the most reader engagement were those where we called out government on not providing robust enough information. A part of me does feel sorry for the agencies who were also kind of figuring all this out, but after a time it just felt like there were certain things that the government fell behind. So one of those was when we oh gosh, I've just lost my place, sorry. So the first story that I've already mentioned was a write-up around the gap in the death toll between the government's official count and the UK death toll. We'll call why what we thought we know is wrong. The story got millions of views, and it really kind of hit home just how much people cared about data in a way that you wouldn't often see. Others included why number 10's COVID death toll slides weren't telling the whole story. The slides shown at the government daily briefings were a recognisable feature of the discussion around around the virus, yet there was very little scrutiny of the data behind them and how at times it misled and rather than enlightened. And then by far the most read story was a story about nearly 15,000 deaths occurring in one day. It showed that more than 1,000 people had died every day in the UK for 22 consecutive days. And that was in stark contrast with the daily death tolls being announced by the government at the time. What all three stories had in common was that they fed into the feeling that the public were not being kept fully abreast of the situation around them. And so, like, from a data point of view, I suppose, like the lessons I drew from that was sometimes it's as important to look at what's not being shown in the data as what is. I also discovered that explainers, like real in-depth explainers, aren't a turn-off for people in something like this. They really want to know about the detail of it. So sometimes explainers are the best tool to getting your point across as opposed to straight news stories. Transparency is key. I mean, I would say that about everything that the government produced, but also from my perspective, I always try to be very clear about where my numbers are coming from, what I'm comparing it to, and what I try to do is just bake that into bake that methodology into the story so that there can be no kind of like somebody taking it out accidentally in the editing process. I think it's been an extraordinary time to work as a journalist. And I don't know if we'll ever face such a big kind of thing in our lifetimes again. But what I would say about it is that I have drawn an awful lot of lessons from it. And I really hope that you can learn something from my experience as well.
Pamela, before we hand over to John, I have a question from Zahra Kosa. Have you explored why people from the BAME community were hit hard by COVID-19 and to what extent institutional racism, inequality, and discrimination played a part. The Guardian did lots of work on it. I know your colleagues worked on it more than you, but you're a team, so I was just wondering if you could comment on that, please.
I mean, we were very lucky in that we had some very good data come out from the ONS around this. I think, personally, I think that if there are inequalities in society, that they will be exacerbated by a situation like this. And I think that that is what we have seen in this period. As you rightly point out, I haven't done as much of this on this particular topic as my colleagues have, but I think everything we have done exposes how societal inequality will and does feed into a crisis situation like this, and that those who are either, you know, economically or less well off, or due to their ethnicity because of baked in inequalities will always suffer most in a situation like this. And I think that that's what we're seeing playing out here.
Thank you, Pamela. We are going to move to John, who is going to talk to us about COVID-19 death numbers around the world, how to compare them, or is it possible to compare them? And also he's going to touch on economic factors and economic numbers that come out of the COVID-19 pandemic. And he will focus a little bit on UK and Sweden, but also look at it from around the world.
Hi, folks. Yeah, I'm just going to share my screen. If I can work out, yeah, I've got the right tab. Cool. So I've quickly added a couple of bonus slides to this about that ethnicity, minority groups and COVID, just to answer that question from Zara as well, because I did a similar talk on that the other day. So yeah, I'm John Burn-Murdoch, Senior Data Visualization Journalist at the FT. Over the last few weeks, some of you may also know me as Death Charts Guy. Someone shared this with me on Twitter the other day. Apparently this is now the sum total of what I'm known for. But yeah, so just very quickly dipping into that question from Zara. So we had a look at this about 2 weeks ago, collating a lot of data, both from the ONS and from a lot of other studies that have been done, to look at exactly that question of what are the structural inequalities in the UK that could lead non-white groups to be at higher risk of exposure to COVID-19 and then mortality from the disease as well. And the key question for us on this piece was, it's the reason that certain non-white groups in the UK have been more likely to die from coronavirus is twofold. It's firstly the increased risk of contracting the virus, of getting the virus, and then secondly, having got the virus, the increased risk of dying from it. So we started with this study from Queen Mary University in London, which showed that Black and particularly South Asian groups in the UK are more likely to get COVID-19. This is not looking at deaths, it's just looking at actually getting the virus. So about twice as likely as white Britons, for example, to get it. And so our question was, okay, why could that be? What are the factors that would lead non-white groups to be more likely to get the virus? And so probably the single most useful, or the single biggest factor in that is occupational patterns. So minority ethnic groups in the UK, or this data here is for England specifically, are much more likely to work in jobs that would lead them to be exposed to COVID-19, and their commuting patterns also make them much more likely to be in these sort of crowded indoor environments where the virus is often spread. So non-white groups in the UK much more likely to be frontline NHS workers, for example, which of course is a very high risk group. Also much more likely to work in industries like transport, i.e., taxi drivers, bus drivers, sales and customer service, so jobs that can't be done from home, and jobs like cleaners, again, where you have to leave your house to go and do a job somewhere else, and it involves some face-to-face contact. So those occupational patterns, and this is that structural inequality, these are generally low-paying jobs that these groups are more likely to be in, are much more exposed to the virus. And again, these people are more likely to commute on public transport as well. There's also the fact that living arrangements. So if you consider if one person gets the virus, what are their chances of spreading it onto other people of that same ethnicity? And when we look at the living arrangements of different racial ethnic groupings in the UK, we find that, again, those Black and South Asian groups are much more likely to live in crowded accommodation, so rooms where there are more people than bedrooms, for example, or to live in accommodation where you've got children, parents and grandchildren all in one property, all of which make the spread of the virus within the household more likely. Then when you take the second part of the factor, which is having got the virus, how likely is it for someone to sadly die from it? Again, we find this time from Public Health England data that non-white groups are more likely than white groups to die from COVID-19 having got it. And the biggest factor we found from our research on this was these underlying health conditions, or what are sometimes referred to as comorbidities. So we found that non-white groups are more likely to have generally have ill health or to have specific comorbidities like diabetes. So that's essentially the two factors, the two vectors, as it were, through which we think, and a lot of the research seems to suggest, that non-white groups are more likely to catch or die from the virus. And as you can see, that's it all comes down to the idea of structural inequality, people being more likely to live in lower quality housing or have lower paid jobs, essentially because of discrimination wider in society, among other things. So that was a quick answer to that question. Going back to the idea of counting deaths around the world. So yeah, this is what most of my life essentially was in April and May, and things have broadened out a little bit more since then, but it was getting a little bit morbid. So for several days, I was updating our trajectory tracker chart every night, showing the numbers of people infected with or dying from coronavirus around the world. And that involved using data from all sorts of different sources. Pamela's obviously explained a lot of the difficulties just in the UK data, and we were essentially dealing with a similar thing, but on a global scale. So this is the chart. This was the first edition of the chart that we put out on the 12th of March. So, or 11th or 12th of March, so 10, 11 days before the UK went into lockdown. And we were trying to answer this question of how many people have got the virus in the UK relative to Italy, and are different countries on the same path? Are we all sort of heading Italy's way? Since then, we made multiple different versions of the chart, and we added in deaths as well. But what started becoming apparent very quickly was that the numbers countries were publishing for their deaths were pretty suspect, to say the least. So if I take the example of Ecuador, this is the chart that we have on our site today, so an interactive version of that chart that I just showed you. And we're looking here at daily new deaths in different countries around the world. Now, in early April, Ecuador's numbers were relatively low. That's about 20 deaths per day, you can see on the chart there, and not particularly rising. But right as we were seeing these numbers, we were hearing reports from the ground from our own correspondents and from correspondents at other news organizations that Ecuador was in absolute crisis, and that there were cardboard coffins piling up in the streets and literal vultures circling in the sky in cities. And, you know, those were astonishing qualitative bits of information we were getting that just didn't match up with the numbers we were seeing. And this was one of the most extreme examples that got us thinking about this idea of excess deaths. So excess deaths, I'm sure most of you are familiar with this now, but it's where you take the total number of people dying from any cause in a country or region in a certain period of, say, weeks or months, and you compare that number to the average number of people who would die in that same place at that same time of year, and you say, what's the difference? Well, this is, and we can use that difference as a sort of proxy for the total number of people who are dying during COVID outbreaks and lockdowns. And what we found when we did that for Ecuador was that the number of people dying in Ecuador actually spiked much earlier. So at that point where you've got a flat line in April, we actually were seeing pretty much the peak of the line there. So we were seeing about 1,000 deaths per day at a time when Ecuador was only reporting 20 deaths per day. So sometimes the discrepancies here were absolutely vast. That led us to throw that whole approach wider. And we're now tracking this for over 20 countries around the world. We're doing that same calculation to work out how many more people are dying in 2020 versus the same time of year in previous years. And you see all of these sort of red spikes, these red peaks, which are showing that those periods when death spiked higher than normal. That's led to me also being involved in a lot of stories we've written using that data and that approach. So in mid to late April, we did our first big story looking at the idea that when you use that excess deaths approach, you find that mortality during COVID outbreaks could be about 60% higher than it actually was being reported by countries. I then did separate stories with our Turkey correspondent, with our Russia correspondent, and just this weekend with our Mexico correspondent using data from there as well. So you know, that was our attempt to solve the problem of dubious deaths data by using excess deaths, which is in theory exactly the same thing in every country, rather than the numbers that countries were reporting themselves. But what we found was even that wasn't perfect either. So on May the 28th, so about 6 weeks ago, we ran this story showing that the UK had the second highest death rate worldwide from coronavirus. Now, the interesting thing that some of you who've been following this may note is that this is actually an amended headline to this story. And when we published this story, it said the UK has the highest death rate from coronavirus worldwide. But within hours of us publishing that story, Spain updated, shall we say, its total death toll from about 30,000 to about 42,000 overnight, or not overnight, but just, you know, with a click of the mouse. So that showed us that even the excess death numbers were moving around quite a lot. And we ended up actually looking into the whole sort of data operation in Spain. I worked on this one with our Madrid correspondent, and even this data that we thought was very robust was still pretty sketchy. So, and a lot of this is for the reasons that Pamela mentioned earlier, in that healthcare operations, national health organizations, all of that kind of stuff, are dealing with completely unprecedented numbers here. And they're getting, you know, that ultimately counting deaths may seem like a very straightforward and simple task, but the amount of work that has to be done behind the scenes to register all of this information, especially in a country like Spain, which has autonomous communities, just like the states in the US, or, you know, not quite to that level, but similar idea. There are huge backlogs often, and data can just it can take a lot of time for things to come through. So we were finding that even the excess deaths data needs to come with a few health warnings, as it were. And, you know, there was all sorts of other stuff going on in Spain. Like, we had this crazy scenario where for a few weeks, Spain's death numbers suddenly plummeted from dozens per day to 0 per day. And in a similar example to the one Pamela mentioned, headlines were written for several days in a row saying no new COVID deaths in Spain. And, you know, that everyone was asking themselves, oh, wow, how's Spain suddenly succeeded at this? But, you know, look for 30 seconds at the actual data that the Spanish government was publishing. And it was clear that that was completely nonsense, because what they'd done was introduce this incredibly high bar, as it were, for a death to be included in their report, which was, they said, unless a death has occurred, unless someone died the day before we're publishing our daily update, we're not going to include it in our numbers. And the key thing there is that I don't mean that they weren't saying we won't include it in our numbers today, but we'll include it the next day. They were just saying we will not include it in our numbers. So for several days in a row, dozens of people were still dying in Spain, but they didn't manage to process those deaths within 24 hours. And therefore they just said, no, those haven't occurred. So for weeks and weeks, we just had to take Spain's data completely out of all of our visualizations. And it was only over the weekend just gone, so about a month after this, that they finally rectified that. But, you know, as I say, they just set this ridiculously high bar for registering data. So no deaths were being recorded, but deaths were certainly still happening. The most recent example of these data issues was the story we did at the start of last week, was this one on the fact that the UK wasn't publishing any of its Pillar 2 testing data at a local level in the UK. And so we had this situation where people in Leicester were being told that they were dealing with a new cluster of outbreaks, a new cluster of infections, and may need to lock down, but the data that they could see was showing still only a few cases per day and no increasing trend. And that's because all of that uptick, all of that surge in new cases was being found in the Pillar 2 data, which the government wasn't actually publishing at all. A day after that, the government and Public Health England did actually put that data out, and we were able to update that. But we've continued to see these issues with the data. There was a story I worked on, which we published only this morning, and I was working on this towards the end of last week, which demonstrates again the issues with the data. So the chart here from that story shows hospital admissions for COVID positive patients in the UK in the 4 different countries of the UK. But a simple line chart like this, you look at it and you think, okay, cool, yeah, that's pretty basic. But this was about a day's work to get this, essentially, because the data that the UK government is now publishing on its website for hospital admissions, it is comparing apples, not just apples to pears, but sort of apples to, I don't know, passion fruit. They're just nowhere near the same things. That Scotland's definition of a positive COVID patient being admitted to hospital is someone who's tested positive immediately before they were admitted, or goes on to test positive within 14 days. But other countries, other parts of the UK, say, for example, Wales includes suspected COVID. So someone who's been admitted without a test having taken place, but they think maybe they have it. Other countries use a higher bar. So I ended up having to go to every individual devolved nation to get its own data that use this same definition. I realize I'm taking a fair amount of time here, so I'm going to plow through this next bit very quickly, which is just on the general idea of visualizing COVID, so data visualization and coronavirus. So very quickly, the backstory to this chart, our trajectory tracker, which became this sort of huge success for us, it's now by far the FT's most visited page ever. It was actually an email to me. This wasn't something conceived in our data visualization team. It was just an email from a general news reporter who just asked me in early March, oh, do we have any data on rises in cases in Italy, and what could we do with that? And my reply to her the next day was just to give her this very rough chart that I made in R, showing this sort of now familiar idea of days since 100 cases along the X, and then a logarithmic scale of new cases on the Y-axis. But the reason I'm showing you this is because I quickly want to emphasize what I think has made some of the FT's graphics in coronavirus especially successful, which is that although the geometry of this chart, the core components and what's on each axis are essentially the final thing we went with, there's a big difference between that and with the chart that you see here, which ended up being resonating so much with people, particularly on social media. And that this is showing, I've taken the actual numbers off, but this is traffic to the page that chart sits on. And I've highlighted with the black arrow when we first added that chart to the page. So that adding that chart to this page really took it from being a sort of something that was just ticking along in the background to something that has become the FT's most visited page ever. The different colors there are just different sources of traffic. So the blue is social media and orange is from the homepage and that kind of thing. But the point is there's a big difference between that draft chart there and this final chart here, and that is the wording. So something we find that is often critical to the success of data visualization is titles, annotations, that kind of thing. So it's just something we've worked very hard at, is trying to work out what the mood is, what is the context around coronavirus data, and therefore at the point in time that we publish a graphic, and therefore what are the messages that we should have in things like titles and annotations to allow people to really feel like, wow, this is telling me something, this is speaking to me, and therefore they want to go on and read that and share it with other people. That chart you can see has now evolved. It's become a bit of a sort of giant squid almost here with all of its tentacles. But this one you can see again how we're able to tell loads of different stories with one chart. We've got the dark blue showing countries that have kept their outbreaks very low. We've got the green showing these large emerging market countries where cases have been rising, and then different other colors highlighting different things. And we've now made this interactive version, which you can see on our site. I'm now just going to skip through very quickly to the economic section. So obviously one of the big questions people have had throughout this whole time has been, are countries, justly getting the trade-off right between the sort of strength, health of their economies and the strength and health of their people. Sweden, of course, we've said is part of the context of this whole talk, and that's been one of the big questions. We all know now that Sweden made a conscious decision to be much less aggressive in its lockdown, much less strict, with a view to trying to minimize disruption to its economy. And we now know that as time has gone by, Sweden has continued to have more new infections and deaths than most other countries in the region. So it does seem that the downside of that trade-off of not locking down as strictly seems to have played out. It's taken its toll. We're seeing more deaths and cases in Sweden, but what about the upside in the economy? So the best data we have on that so far is this data from the European Commission, which is looking here at a forecast but you know, based on the real-time indicators that we have so far on how key economic indicators like GDP and unemployment are expected to change between 2019 and the end of 2020 in different countries. And so what you're seeing here is on the left, you've got countries whose GDP, the overall size of their economy, is forecast to shrink a lot year on year. And on the right, it's only forecast to shrink a bit. You'll be shocked to hear that no country is actually expected to grow between 2019 and 2020. And then vertically at the bottom, you've got countries where unemployment is forecast to broadly remain the same. And then at the top, unemployment is forecast to rise. So what that means is in the top left is the worst of both worlds. You've got a shrinking economy and rising unemployment. In the lower right, it's the best of both worlds. You've got a relatively small contraction to the size of the economy, and relatively little change in unemployment. So you can see that Japan and Germany, and both of these are countries where they have locked down, but it's been sort of a smart lockdown. Germany never locked down nearly as strictly as the likes of Italy, France, and Spain, or even the UK, but it locked down intelligently. It locked down early, and they got a lot of testing in. Japan similarly has never had anywhere near the kind of lockdown that a lot of European countries have, but they've had very smart policies around avoiding crowded indoor spaces. And so it looks like Germany and Japan are likely to see relatively little rise in unemployment because they've not been shutting all their workplaces, for example, and relatively small contractions to their economic output. And as we know, their outbreaks have actually been relatively small in terms of cases and deaths because they use those other intelligent policy decisions. Whereas Spain, in the upper left, had a very strict lockdown with people not allowed to leave their houses pretty much for months. And you know, sure, for grocery shopping, but a much stricter lockdown than in the UK. But they've still seen an enormous number of deaths from coronavirus, very similar number to the UK. And the impact of that strict lockdown means that their unemployment has shot up and their economy has contracted quite a lot. If we look at UK and Sweden, they're both somewhere in the middle. So the UK is looking like it's going to have a sort of, you know, moderately large reduction in GDP and about a 3 percentage point increase in unemployment. Neither of those things are great news, but much less acute as what we're seeing in Spain. Sweden looks similar, perhaps a smaller contraction in GDP. So that difference horizontally between the UK and Sweden could be seen as how Sweden's more relaxed lockdown has helped it. But as you can see, unemployment is still expected to rise. And that's because people have still been voluntarily socially distancing and closing some of their businesses in Sweden. And so there is still an impact there. People have still lost jobs. And then you've got the US at the top with a sort of moderate reduction in GDP, but rocketing unemployment. And then very, very quickly, last slide. And sorry, the text on this one is a little bit smaller. But if you can make it out, this is 3 of Google's measures of how people's mobility has been changing over time, over the course of the year. So we've got the number of people going out to shop and to entertainment, like cinemas, shopping centres on the left. In the middle, it's the number of people on public transport, and on the right, the number of people going to their workplaces. And what you see in all of these is that the UK is really suffering from having lockdown late, and therefore its lockdown is having to go on for much longer in order to before people can actually, first of all, be allowed to go back to normal life, and second, to feel comfortable doing so. And as a result, the UK is, in terms of that return to normality of people going out, feeling safe to do so, it's lagging a lot behind. You can see with Sweden, the retail chart, Sweden is essentially now seeing the same levels of activity in shops and cinemas and restaurants as it did at the same time last year. It's back on that 0 line. Whereas if you look at workplaces over on the right, you can see Sweden has just dipped back down and is now close to Spain. So there is still some hesitation about going back to work in Sweden, obviously, as the numbers of new infections remain high. But yeah, so that's an overview of what we've been looking at. Obviously a lot there, and I'm sorry, I think I've overrun slightly, but I will now leave it to Helena unless there's any immediate questions for me.
No, we're going to zoom on Sweden with Helena, and we have some good questions here, but I will ask them at the end. So, Helena.
Hello, everybody. So this has been really interesting, and I'm gonna follow it by being very sort of local and talk about a couple of things that we have done in Sweden that is quite particular to Sweden in one way, but also shows you how, what kind of data stories we did with the coronavirus. I'm going to share my screen very quickly here, if I can. There we go. And come on, there we go. And I'm just going to tell you very briefly, we have 3 data teams, you could say 3 data teams at SVT News. We have a research team, which a lot of their work, they do sort of ordinary research as well, but a lot of their work is actually data, collecting data, using statistical data and so on, doing shorter projects. We also have an amazing visualization team that presents data stories for the web. They do some analysis. And then we have the team that I'm on, where we do use a little bit more advanced technology. We do a little bit of longer projects. So as Pamela, I was also away at a conference in New Orleans when this sort of just came home. And I wasn't as lucky as Pamela because I came home and got sick. So while I was at home sick, my team were a little bit sort of struggling in what they would do. We usually don't do daily stuff at all. We work on 3-week project to 1-month projects, or even longer sometimes. One thing that Sweden has that is quite unique for Sweden is something we call quality registers. That is databases run by doctors and nurses all around Sweden, focusing on one specific thing. So we have, for instance, we have implant registers for different implants. So we would have a pacemaker register or a hip replacement register and so on. But we also have registries, and what these registries do is basically that they keep track of every single procedure in that specific field. So for instance, we would have, as we discovered when we started working on this, a national quality registry for intensive care, which basically has almost all the intensive care units around Sweden reporting in on a daily basis how many people there are admitting at that day. And this was a big thing for Sweden, since the real scary thing was, of course, that we wouldn't cope with the intensive care patients. So we started out by talking to them, and I especially liked Pamela's view on start developing a relationship. We really developed a relationship with the people who are running this registry. And they actually started out that they already had a specific portal for influenza and virus. So when we just started looking at that, they actually had a very small graph that indicated the coronavirus. But as we worked together with them and started actually scraping, and that was one of the things that members of my team had to do while I was at home being sick, they started scraping this, and as we were producing stories about this registry also added on different kinds of ways to slice the data. So what we did was we took the data from here, and our amazing visualization team built this website, which is called Corona in Intensive Care, where you could sort of every day, basically updates, I think, every half hour, if I remember correctly. And it updates sort of on how many people who have been admitted into intensive care with the coronavirus or with the COVID virus. And this is where you can see the new patients added in every day over the amount of time. And you can also look at it from a local point of view. So you can look at different locations and see where you have that. After that, we started talking about there must be other registries. So we actually started talking about what happens to the people who no longer can get into hospital. For instance, what are the people who have scheduled elective surgeries, like a hip replacement, for instance, or a pacemaker, for instance, that is not threatening for life, but it's still something that will improve those patients' life quality. So we found this registry, which is the operations registry. And this was a little bit different because here they do have a website, but they really don't have a report about canceled operations, because nobody up until now have been very particularly interested in operations that were canceled. Whereas now we were, of course, very interested in that. And my colleague developed a very close, she started talking to, there's actually one person who runs all the data, both in the intensive care registry and in this registry. There's one person who does that, not the same person, two different persons. And started talking to the person running the data here. And I cannot stress what Pamela also said, is that when you're working with this kind of thing, is to find the actual persons, the actual statistician or the actual data person who are working with the actual data. I mean, press officers could be good and you could keep them informed, but as Pamela said, get a relationship with those people. So he actually started putting together a report just for her, and then after a while they had to sort of release it to more news outlets, of course. But we started in the same way, using the data that they sent us about operations that had been canceled to do a visualization, where our visualization team took the data that the research team had gathered, and they could then show sort of, and this is a graph showing how it looks from a normal week, sort of how many elective surgeries, elective operations have been canceled compared to what it would have been normally that year. And even also here we can divide it up locally into different local areas. As you can see, Stockholm is more affected, for instance, than other places are more affected than some places. But we didn't stop there, because that's one part of it, sort of showing the numbers. But we're a television station and we need people in our television segments. So in this, we also did a crowdsourcing, where we basically just put a small form from Microsoft Forms up, asking people, have your operation been canceled? And we got a number of answers, and we did this application where that's told we who waits. And people could then tell their story. Sometimes they film themselves or asked a relative to film them, and they told their story about how they, for instance, had hoped that they could walk out in the forest this summer with their new hip, but actually I can't anymore, or I can't, and so on. So this was one of the sort of actually doing the people behind the numbers story that we did. Another story that actually happened from a local station, our local station in Stockholm had done a story about a single care home that had a very, very high death rate. There were a lot of people who had died in this specific care home, and they did a local story on that. And at this time, I was actually back at work, working from home, but still back at work. So I wasn't sick for the whole time. And we started talking about how could we expand this to do this on a national level. And I have to teach the people who are not from Sweden a little bit about how Sweden works. We have the oldest Freedom of Information Act in the world from 1766. And that means that a lot of data that isn't open in a lot of places actually is a public record in Sweden. And for instance, is where I live is an open record over everybody, almost everybody lives. And it's the tax authorities that runs that database of people. So for instance, we could search for me in the database, and you need my name. I have a pretty common name in Sweden, so I need to sort of put a somewhat age on it and where in Stockholm. And then I get, there's two people who actually are born in the same year. that live in Stockholm. So I'd have to do a little bit more research to find out that the second person there is me. But if we take my address, I can then go back into the database and I can say, okay, give me everybody who lives in my address. And this is all my neighbors. So this is not all of them, but most of them who lives in the same building as I live. So we started thinking about this when it came to, because the problem with, even though we were we are a very transparent country, and we can get data and information, more information than data about a lot of things. When it came to the number of people dying of COVID in care of the elderly or in care homes, local councils and care homes were very, very reluctant to share this data. So there had been local stories all over the country where local councils, or sometimes even regions, but local council had refused to share numbers of people dying of COVID-19. So we thought about it, how could we do this? And one of the things they had done with this local story in Stockholm was that they had looked at the address of the care home, and they had seen how many people who had died on that address. So we started thinking that maybe we could do the same thing, but for all the care homes in Sweden. So what we could do is that we have a database that is really a database that we use for corporate doing research on companies. And you can select companies in a totally different way. The usual thing we do is, of course, that we have a name of a company and then we pull out numbers about the company. But we can also look at the industry codes. And I think in the UK, they're called the SIC codes, or the SIC codes. And here we have the sort of industry code for care homes for elderly people. And that's a very specific code, because we also have care homes for people who are not elderly, but who have a handicap of some kind. So we took that code, put it into the database, and we got all the companies in Sweden who run these kinds of care homes. And from that database, we could also pull out all the addresses of all the locations where these companies had their care homes. So we took those addresses and we started out by talking to the tax authorities and said, could you please give us the number of people who have died on these addresses? And the tax authorities said, no, we can't, won't do that. We will not do that kind of job for you. And then what we ended up doing was going to a commercial company, I saw that I had, which is this one, who buys the data from the tax authorities and actually publishes it online. This is a free website that you could use, and you could, the same way as I did in the pay for database, I could here put in my address, and here we have all my neighbors again. And we talked to them about helping us with this, and they said we'd be happy to. And we then gave them all the addresses. This is the addresses. And they came back with numbers of all the data. So for instance, here on the third row, you can see that. And what we asked them for, and I think John made a certain point when it comes to the excess deaths, it's very important what we did here. We had to abandon the thought that we could get dead by COVID or dead by coronavirus, because that we couldn't get that. The local authorities refused us. So what we were thinking then was that we could actually look at the excess deaths. We could look at how many extra people had died compared to previous years in the same period of time. So we basically asked the company to run the numbers for these addresses for 2017, 2018, 2019, and 2020, the same time period. And there are a number of errors in the there could be errors in this. For instance, it's not necessarily so that an elderly person always changes their address when they move into a care home. If they have a spouse at home, the address could very much stay there. But what we figured was that that situation would be about similar for the previous years. Nothing indicated that all of a sudden there would be less or more people having that address than it was previous years. So for instance, in what we could see in some, and we didn't see these patterns in all the care homes, but in some care homes like this one outside Stockholm, we saw that the number of deaths in 2017 was 13, in 2018 were 18, in 19 it was 15, and then in 2020 they had 40 deaths registered. It doesn't say that everybody died from corona. It says that there was this difference, and that's the difference that we reported on. So we reported, well, what we found was that there was an excess deaths of 30% in the whole country. But we also saw that in Stockholm, in the Stockholm area, it had doubled. And we could report this, of course, in different graphs. You could see that here we had the Stockholm area. And that was also interesting because one thing that people were very interested in was the fact that were there more deaths in the private care homes than in the care homes that were run by the councils. And when we first ran those numbers, you could see that there were a significant higher percentage in the private care homes. But as I saw that number, I thought, okay, wait a minute, this is something that might not be correct. And of course, the COVID virus didn't hit Sweden equally all over actually it hasn't still hit Sweden equally all over the areas. Stockholm had been much more affected than the rest of the country. And we also have a totally different, in Stockholm actually more care homes are private than, or it's about 50-50. Whereas in the rest of the country, there are very few private care homes, and most of the care homes in the rest of the country are run by the council. So that meant that the graph that everybody was looking for, which is the one number 3 here, we had to change that into just showing Stockholm, because if we had shown the whole country, it would actually have shown the wrong story. And we got, experts talking about, have we protected them or not? Our Agency for National Health still claimed up until they were interviewed here that they had been able to protect the elderly. I'm not so sure that they really had that. I'm actually quite sure that they didn't. And we could also do a local story where, because we had data from all over, so we could find elder care homes also in the country that had a higher rate, a doubled rate, even though maybe the care homes around them didn't have that at all. So this is one of the local stories where they had, I think, an average over the last 3 years of 3 or something like that. And this year they had 18 people dying. And this is another of the care homes. And something that's very important, us being a television station, we are restricted in how many, how long our articles can be. Luckily, we're not restricted when we talk about how we did something. So this was really important to us. Pamela talked about transparency. It's really important for us to talk about exactly how we did this, exactly what kind of pitfalls that were in that, and how we dealt with those pitfalls. This is a very long story about how we did this project. But as we also work in television, we really need to get the numbers, the people behind the numbers. So since we knew which day it was that was according to this data, where most people died in care homes, we could actually do a story about a day in April, which is April 15th, which was the day that most people the most people died. And we actually got the relatives to either tape a little story where they talked about their relative, or they wrote a story to us about, this is a story about their mother, for instance, who who died in COVID. So this was really important for us to also show the people behind the numbers and not just doing the numbers.
Helena, I have to
yeah, I'm
stopping because good
time.
Thank you. So we have quite a few questions, and I'm going to have to cover as much as possible. The first and by far the most popular question is from Sonia Jude to all of you, and it's about the tools you used to analyze data and look at data. So can you please, each of you, briefly say your favorite tools that you used?
Well, funny, when I saw Sonia's question, I thought, it was the case that I used to do 80% of my work in either, well, usually it used to be Excel, and we use Google Sheets now, but especially because it's much more easy to interact, because we can all work on a Google Sheet together throughout the team if we want to see each other's work. But so it used to be 80% of Excel, and then I kind of started using Python more and more, and pandas, and so I use Python for scraping, but also very large data sets. And I had really kind of gone over that. So I'd reduced maybe from 80% down to maybe 60%. Helena, my old boss, Helena, will not be happy to hear this because she's still a big lover of Excel, as am I. But I found actually, because of the coronavirus, because my role was more analysis rather than going out and grabbing data, I actually find that that probably the proportion of my use of Excel went back up to 80% over the course of this. And then the other thing I would say is that mapping software, like I use like Data Wrapper if I needed to visualize, for example, excess deaths per local authority, so that I could see the patterns that were there.
John?
Yeah, the first thing I'm going to give is the annoying answer, which is that I think ultimately it's much more about journalistic a journalistic mindset than about any given tool. I sort of transitioned from spreadsheets to programming languages like R about 5 or 6 years ago, but that was absolutely not a sort of one-way transition, and I now only do things in R. I would still say when I'm on very tight deadlines, that's actually, which is with COVID quite often, I'm much more likely to just go back to a Google Sheet, because when you need to quickly do some number crunching, and as Pamela said, when you're probably collaborating, and every one of the shared bylines that I showed you on my slides earlier was with a non-data journalist, so with someone who's much more familiar with Google Docs than with spreadsheets, let alone programming languages. And so spreadsheets just a lot more accessible in that sense as well. But I've also been working on a lot of projects, COVID or otherwise, where reproducibility is really important, where it's important that I can run my code, but anyone else on the team can also run my code to get the same results. And so I do a lot of stuff in R for that reason as well. And we use GitHub as a team, for example, to collaborate on all of our bigger interactive projects. So it's really about, I think learning more tools like Python and R is extremely useful and will hugely pay dividends. But it's then ultimately just about whatever's the best tool for a job. I think there's sometimes this unhealthy debate of like, oh, if you're doing something in a spreadsheet, you're not as good as somebody who's doing it in code. And that's frankly nonsense. And it's just about learning the tools that will help you and your newsroom, you within your newsroom, get stories done well and quickly.
Helena?
Yeah, no, Pamela's basically given my answer already. We work mostly in Excel especially for the care home story. I did a little bit of visualization, not for the web, but for our reporters in QGIS, which is a geographical system to locate whereabouts the care home was geographically and things like that. But since this was a team, this was very much a teamwork with a lot of people involved, and using anything else than spreadsheets then is almost impossible. So we did a lot of, we used mostly Excel for that.
This is a complete plugin from the CIJ, but we teach all of these tools and we're completely non-discriminatory of which one you want to use. You start with Excel though, I'd say. Now, second question, this is for Pamela. From, again, Sonia, what would you do differently, if anything, were you to wind back the clock to mid-March 2020?
I love this question. So my original thought was, oh, I would have, like John said there, I would have automated so many things early on, and you know, being able to come back to them time and time again. But had I have done that, I actually would have made more work for myself, because as the statistical agencies and government bodies and health authorities were struggling to deal with COVID, they also changed their mind a lot. So had I have had I have automated certain things too early on, I would not have actually been able to use them again. So I think I would have done a little bit of that, but maybe in hindsight, it was better that I didn't. Sometimes, although automation is a godsend and I absolutely love programming, sometimes it is just better to do things manually. Also, sometimes when you're programming blind, whereas when you're collecting data day by day manually, here you really learn about it. So probably a long-winded way of saying I wouldn't have changed that much in that respect. The one thing I would have liked to have done, and I wish I'd have done, but it, you know, we're a small team and we simply cannot do everything, is I wish I'd have done more on testing early on, because that just turned out to be such a minefield. And you know, I think there's another question later from Leniart who's asking, you know, about, you know, tier 1 and tier 2. I think John will be able to answer this much better. But what I thought it was, you know, it's very hard to say why the government didn't come in for more criticism early on about its testing system, whereas like counting deaths and things, I think maybe was more prominent in people's minds. But yeah, I really wish that that I'd have tackled the testing data in more depth personally.
My next question is for John, I think, because, well, John, I'm sure you all can do it, but John has been focusing on data from foreign countries. How do you access data from foreign countries, especially if you don't speak the language?
Yeah, sure. So multiple different ways. So we do, to an extent, rely on some of the other international aggregators. So the European Centre for Disease Control and Prevention publishes a sort of collated set of all the daily numbers from different governments. But we don't rely solely on that, because the ECDC, you know, they're a great organization, but they will tend to just publish exactly what they're given. So for example, that issue with the Spanish data that we had earlier was one where we had to sort of do our own reporting and a manual override on that. And we do that probably with about 20 different countries. So we have you know, I've got a Google Sheet which has a list of the links to where each country, again, not every country in the world, but about 20 odd countries publish their numbers. So I can go direct to the Spanish site, the French site, the German site, and so on, to see exactly what numbers they're putting out, to make sure, first of all, to make sure that there's not been a sort of typo from the aggregators that we're relying on, because sometimes people literally just type in the wrong numbers. And also to make sure that if there is anything weird going on, if a number shoots up or goes to zero, that we can check exactly why that's going on, see if there are any footnotes on the page, for example. But in terms of language stuff, so obviously the nice thing about being a news organization at the FT is we've got correspondents all over the world. So I've had phone calls with our people in Beijing, in Mexico, in Russia, in India, all over the place to talk about their data. So, you know, whether it's translation or whether it's finding out what's going on with their latest numbers, that's a sort of speed dial service for me. But there have been some really more sort of esoteric examples of this as well. So there was one point in, it was probably April, when I was trying to get the latest numbers of deaths from Daegu province in Korea, so a specific province within Korea. And I sort of put out a call out on Twitter and ended up finding a Korean speaker who went to their website, found the right page that was all in Korean, translated it all for me, and gave me this spreadsheet of the data. And it would have been impossible for me to do that, for me to even find it, the data, let alone to translate it. And that kind of thing has happened a lot with, you know, we set up a specific new email address at the FT, coronavirus-data@ft.com, and people have been sending us data from their countries as well throughout. So a lot of it has been relying on that assistance, whether it's from colleagues or members of the public as well.
And that last question, oh yeah, go on.
Just to come in on that point, we did a story on excess deaths, and I know that, you know, John and I are in an enviable position where we do have colleagues overseas. But one thing I would say was there are times throughout this crisis where I've really needed to understand something about the data in Italy or in Germany or something like that. And it's conferences like these where I've made really good contacts where I suddenly know a data person in Germany or in Italy, and those sort of friendships have been really useful. And so for those who are not maybe in larger newsrooms and need to rely, then these are the exact sort of like networking opportunities that really allow you to like kind of reach out to somebody and say, hey, I really need to understand this specific thing about why, the death rate in Italy is 3 weeks out of date and exactly what that number pertains to. And I find that really useful through this process.
Okay, last question for Helena. Why were the local care homes reluctant to share data? Were they afraid of their standard of care being called into question, or was it simply lack of them knowing whether the death could be attributed to COVID-19?
I think it was a combination of those two things. And that was something that I realized I forgot about. And one of the reasons why we also thought that focusing on the excess deaths in general wasn't that bad was that we got a number of stories from different care homes where they said that people there were dying without them having been tested. They didn't have time to test them, and so on, and they didn't have time even to put them into hospitals. They would pass away at the care home. So I think that one was certainly that they didn't know, but also that they were very afraid that to be criticized in a way, and this was, and I must say that this has been an extremely unusual situation for everybody, including the poor people who run care homes. So, I mean, they were very highly, there was a lot of discussion, which wasn't really a data story, so I haven't talked about that, but about the lack of protective wear in care homes in Sweden, for instance. And that story had broken like 3 weeks before we did this story. So they were reluctant in different ways. And they also I think, were a little bit afraid of personal integrity and said that we can't give this out. That was usually what they cited when we asked them, was that they said, we can't give this out because of personal integrity. And we said, we only want numbers. And they said, well, you can still maybe identify somebody because there could be just one or two. But I think that the two causes that this person who asked the question cited was actually a combination of those two. That's my personal thought. Yeah.
Unfortunately, we have to finish. I thank all of our panelists, Helena, Pamela, and John. And I wish COVID-19 wasn't the reason for data journalists to become rock stars of news, but it was. So if you want to join the rock band, you know what to do. Learn data and read more data journalism stories. Thank you very much to everyone for coming. We have 2 more talks today, so please stay tuned, and thank you very much for panelists.